Day 2 of the HAVI virtual conference. I'm Fatimah Loren Dreier, Executive Director of the HAVI. For those of you who joined us yesterday, I hope you found it, as I did, deeply authentic and healing day. For those of you joining us for the first time today, welcome. I hope you spend your time here connecting, asking questions, and learning from each other. The recordings of day 1 are available for you to review at your convenience. Some of you may be wondering about next year's conference already, so I'd like to take this as an opportunity to share with all of you that next year's conference will be in person in Detroit. We're very, very excited. So mark your calendars, September 20th to the 23rd, 2022. All right, now I'd like to introduce you to our esteemed guest who is joining me for a fireside chat, Dr. Ibram Kendi. Dr. Kendi is the author of the #1 New York Times bestseller, How to Be an Anti-Racist, and Stamped from the Beginning, The Definitive History of Racist Ideas in America, which won the National Book Award for Nonfiction, and the Black Campus Movement, which won the W.E.B. Du Bois Book Prize. Dr. Kendi is truly one of the most powerful voices of our time. His analysis and critiques of the system of racism and white supremacy get to the heart of the crisis broadly, but also within the gun violence community, much of which is rooted in systemic racism and the pervasive inequities it has produced. I hope our conversation will provide an opportunity to help shift the narrative about violence during this moment in our transformative social change movement and an unprecedented attention to the harm that systemic racism has inflicted on Black Americans throughout our country's history. So without further ado, welcome, Dr. Kendi.
Thank you. It's an honor to be here.
Thank you. So I'd love to just start. We are a movement of people who work on gun violence in Black and Brown communities. And I'm curious how violence has shaped your life. How have your lived experiences of violence contributed to who you are today?
So first, Fatimah, I'm so glad we're able to have this conversation, and thank you so much for helping to organize this. And so I grew up in Jamaica, Queens, New York. And I think that growing up, in this sort of so-called inner city Black community, I was constantly being told by people inside and outside the community that it was dangerous, that it was extremely dangerous, and that it was extremely dangerous, not because necessarily there's gun violence, but because there's Black people, and that the Black people is the sort of prevailing variable that then leads to the gun violence. Right. And so I, in a way, sort of was raised to think that Black people in Black neighborhoods were dangerous, and I think it really wasn't until I sort of came of age that I began to realize, no, actually, if there's a problem, it's gun violence, not Black people. But it took me, a long time, just like I think it takes many Americans a long time, if they ever get to the point in which they can disconnect Blackness from violence and start focusing on violence and the causes of it.
I think that's very, very powerful because we know that gun violence disproportionately impacts Black and Brown boys and men, but it's so important not to assume it is their very color, their race, Blackness, or Latino identity that's driving it, right? That association has much deeper roots that are connected to structural racism and profound neglect in neighborhoods. So I really appreciate your sharing that point. We're thinking about, and I appreciate your book. I actually have it I have it here on my bookshelf. So thank you for thank you for it. You really dive in your work on history, understanding the thread of racist ideas in America, and I think those are deeply intertwined with violence itself. And so I'd love to to kind of help us understand throughout history the links between race, racism, and violence.
I think many of us know that enslavement was a violent institution, that the reason why Black people were enslaved for upwards of 250 years wasn't because they're destined for enslavement, right, was because violence was normalized. Just as violence was normalized in settler colonialism, just like violence has been normalized in mass deportations and in the policing of undocumented people and even immigrants throughout this country's sort of history. And what was fascinating, because I'm obviously most familiar with enslavement, was you had an institution that was routinely violent. So violence, or the threat of violence, and many different forms of violence, physical, sexual, literal torture. You had an institution in which that was the norm, that was regular. And it was sustained by multiple levels of violent forces, from overseers to masters to slave patrols to literal militaries. Most military people were stationed out west or in the slaveholding South.
Yeah.
And so then when enslaved people decided that they were going to resist this violence, either individually, in other words, they saw somebody violating their wife or whipping them, and they decided to respond with violence to defend themselves, they were called violent. When they engaged in slave revolts, they were considered savage barbarians who were extremely violent. And so it's just striking to me. I don't think I wanted to really document that in Stamp from the beginning. Yeah. How you could have a white enslaver. Imagine that those Black people who are fighting for their freedom are the violent ones. Yes. But that's precisely what's happening today, and in which those who have created structures that maintain the normality of violence in this nation are then calling the people themselves the violent ones.
Yes. I'm really grabbing hold of that notion of maintaining the normality of violence, particularly structural violence today. How is it possible that we expect people to stay down when the impact of structural racism and that violence is so pervasive all the time, right? We would imagine, as any human, there'd be some reaction, some response. And, our movement is really about healing some of that, both at a structural level, but then for those who are actually directly impacted by this day in and day out. So we're going to touch that in a moment. But I want to stay in this kind of space of this new maybe new conversation we're in nationally about racism that, of course, has arisen through a global uprising, the loss of Ahmaud Arbery, Breonna Taylor, George Floyd, that spurred rebellion and protest throughout the world, has inspired, I think, a number of people to have hard conversations, difficult conversations about the pervasive nature of racism in our society. And I think that for many white folks, this was could be a very challenging place to begin, right? And that desire to say, well, I'm not racist, and think that that's enough. But you've offered, I think, another point of view, which is that it's not quite enough to just say that you're not racist, but instead have to be anti-racist. So can you kind of lay the foundation for us? What does that mean to be anti-racist? How does that show up or might show up in people's lives?
I think it first is important for people to realize that we live in a society of racial inequities, and disparities, where people of color, particularly Black, Brown, and Indigenous people, are more likely to be incarcerated, more likely to be dying as a result of violence, more likely to be impoverished, have lesser levels of wealth, or more likely to be fired, or less likely to be vaccinated, or more likely to die from COVID-19, or more likely to be housing insecure, food insecure. And so we have this society of racial inequities. And so what happens if an individual decides to do nothing when you have a status quo of inequity? The inequity persists. And then those who benefit, let's say, from Black people's votes being suppressed, what they want that person who is doing nothing, as that policy is coming down the train tracks, what they want that person to do nothing. They want it to just ride on by and go about their day, because the only thing that can stop it is the resistance, of the people. And they don't want people to resist. They want people to do nothing. And there's a recognition that doing nothing when you have a status quo of injustice is complicit. You're being complicit in that injustice. And I think once people begin to realize that, once they realize, I mentioned earlier about slavery, that enslavers wanted non-enslavers who were white to do nothing. That's what they wanted. That's the purpose of racist ideas more broadly. I mean, the purpose of racist ideas is to convince people, yeah, all those Black people are dying from gun violence because they're dangerous, violent people.
Right.
There's no there there. There's nothing I need to do. And so to do nothing is typically to either not have that courage or to be infused with racist ideas, and thereby to allow the persistence, of this structure of racism, and thereby to be racist. While to be anti-racist is to challenge that structure, is to actively seek to dismantle it. And so that's the question for us. Are we actively seeking to dismantle this structure of racism? Are we reinforcing it by our action or inaction?
Really, really powerful. And, I'm reminded, and I'm so grateful that our audience is beginning to be active on our chat. So we want to encourage that. We hopefully will have time for audience questions later in our conversation. But this piece around how important it is to maintain a structure in which there are clear beneficiaries of the existing inequity means that there's a whole swath of people that are complicit, that do nothing. And any disturbance in that system can create a lot of tension. And I'm thinking now about the very active debate about critical race theory and the threat or the idea that that having conversations about race itself is problematic or can be really triggering. What I'm curious, even in your work, if folks have shown up and said, why this topic? Why now? We already have books. We know slavery happened. It's in the past. What do you say to that level of resistance? Where does that come from? What is that helping to maintain?
Well, what I say to that level of resistance is, I say, so I ask, I should say, if quote, racism doesn't exist, if it's a so-called left-wing myth, to quote the former vice president, then why does racial inequity exist? Why are Black people more likely to be impoverished? And then the only other explanation is there's something inferior or wrong with Black people. Mm. And then, I asked him, so how do you define a racist idea? Since you just argued racism doesn't exist right before you started expressing racist ideas. But ultimately, I think that one of the sort of complications of the structure of racism is that it indeed harms, as we've talked about, disproportionately people of color, and we know that, and even white Americans know that, and so as a result of racism, white Americans have certain privileges that, let's say, people of color do not have. And so because of that, they're easily organized to oppose efforts to deconstruct, racism. But what I think more and more white Americans may be starting to realize is that indeed that people of color are harmed the most as a result of racism, but white people are harmed too. They're not harmed as much, which then creates a level of privilege, because privilege is on two levels. Privilege is, we're both poor, but Fatimah, you're not as poor as me, right? So in a way, you have a privilege, but so I think people are starting to recognize that yes, they have privilege, but they're still struggling as a result of these very policies. I think especially as it relates to violence and gun violence, and people recognizing that the greatest domestic terrorist threat of our time are white domestic terrorists, and the number of white people who are being killed, and the ways in which we now, because of our gun laws, we can have a lynch mob of one. As I recently wrote last year in the Atlantic, that one person can engage in a lynch mob, and part of the and people are also recognizing that because of our sort of lax gun laws in certain states, that white men in particular are engaging in incredible levels of suicide by handgun, right? In specifically the states where gun control policies have been lifted. So I think people are now starting to recognize, whoa, so our elected officials pushed those laws. They opposed strong sort of gun safety laws on the premise that those white men would be able to protect their families from those so-called Muslim terrorists, Latinx invaders, and Black criminals. And now those white men got their guns and they're shooting themselves. And so I've been duped. Yeah, you've been duped. We've all been duped. And you're being harmed too. And I think people are beginning to recognize that.
There's quite a bit in what you've said, and I want to actually shift some of this. You raised that this impacts all of us. Racism is not fundamentally a Black and brown problem. It is a human problem. It's a challenge that impacts all of us differently, but all of us. I really appreciate that point, and this piece around how we understand or respond to violence that shows up. We're a movement, Dr. Kendi, that really lays claim to violence as a health issue, as something, instead of the use and overuse of the criminal justice system, and over policing in communities as a response to violence, that instead it is about marshaling a whole ecosystem of care and healing of trauma, that ultimately that gets at the root causes, addresses what we call social determinants of health. If we could provide folks with housing, right, and food and ways to support themselves economically, that we can actually disrupt these cycles. It's a very powerful frame, right? It's a paradigm shift. And so we're on the kind of health bandwagon, right? We really care. We think that this in and of itself is a paradigm or a way of viewing an issue that is powerful and compelling. And we are seeing all sorts of advances in policy saying healthcare. This is the way that we look anew at the needs of boys and men of color who are at greatest risk, right? This is a way that we can view them as with love and care and mobilize, right, a workforce of people who are Black and Brown, who are directly impacted by violence themselves, who can offer that care and support, that are really on the front lines as violence intervention specialists. So we are working to kind of construct this whole ecosystem, right? But one of the challenges we have, and the reality we have to confront, is that healthcare itself has its own challenges around structural racism. Mm-hmm. And there's a real need for us to interrogate this new frame, this frame that we think is certainly better than the criminal justice frame, but still has its own work to do. So I'm so curious about if you can speak to racism in healthcare, some of the racist ideas in history connected to healthcare, and how that might affect our view today.
Sure. So I think first, let me just sort of applaud the community for this sort of this organizing sort of principle and this new frame and this move away from this sort of criminal punishment sort of frame. And I would just also urge everyone to recognize that this frame and this approach to get at the root causes of violence is actually more effective in reducing violence. And so that's one of the ironies for me. These, law and order, broken policing, tough on crime advocates are actually not anti-violence because the policies and practices that they put forth don't actually get at the root at all, of the issue. So you claim, so that's been my response to those folks. No, you're actually, so, and puts them in a situation in which they have to somehow prove that not getting to the root of crime, I should say violent sort of violence, is somehow going to reduce this issue. But what they typically say is they say, oh no, it's actually not these structural forces, it's the people. And then that allows you to demonstrate that their whole framing is built on racist ideas. Yeah. But to your question, I think that when it comes to healthcare, for the better part of this nation's history, let me first say, in 1890s, that was the first census that started, that people began to recognize the existence of what we now call racial health disparities. Mm. And the scholar who really brought that to light, who became really the father of public health, but a German-born scholar by the name of Frederick Hoffman, published a book in 1896 called Race Traits and Tendencies of the American Negro. He, in this book, outlined both health and criminal justice, or I should say crime disparities, and argued that both were the result of Black people's predisposition, or I should say, it was the result of Black people headed towards extinction. And they had that Black people were a different species of being compared to white people, with separate Black blood and separate Black organs, and that their constitutions were such that they were predisposed to both violence and disease, which then is going to then lead to their slowly dying away. That was, of course, the whole survival of the fittest. Of course, it was imagined that Black people were not fit and that they would die away. I'm mentioning that because that was really the origins story of public health. That was really the origin story of how people understood both crime data and health data. And so by the 60s in particular, more and more advocates were like, no, actually, the reason why Black people are more likely to have certain diseases is not because they're genetically distinct, but it's because of their behavior. They don't take care of themselves. They don't eat right. Their culture is predisposed to, quote, bad, unhealthy eating. And so I'm mentioning this because this links very closely to, in the 60s, you had criminologists saying that you had this sort of Black cultural predisposition to violence. And so I think, as you're making this shift, you have to be sort of aware, of these prevailing history of racist ideas in healthcare and the criminal punishment system, because they have been interlinked from the beginning.
It's a very important point and I think a critical reason why we need to understand history so that we can, particularly the history of ideas, which I think your scholarship on the history of ideas is really critical, because those ideas are recycled over time. They get an update, they get a buffing off, and they expose themselves in society. And so I think for us in healthcare, it's something we really need to pay attention to. And these cultural arguments are kind of everywhere, right? This is because these are folks of color that we see these disparities, and we have to be very, very careful of that. So thank you for lifting that up. So I've mentioned this remarkable workforce for our frontline violence intervention specialists. They are community health workers who are many of whom are directly impacted by violence, are formerly incarcerated, and bring a tremendous genius to the work of disrupting cycles of violence through their lived experience, through the deftness through which they're engaging with clients who are making decisions every day that impact their lives. And we had in our opening plenary yesterday a very powerful discussion about equity in not only respecting and honoring the work of frontline workers, but also what does it mean to be allies to frontline workers if you do not identify and are not doing that work. And so we looked at it from a research perspective. We had a researcher on the call. We had on the line. We had a clinician who's a surgeon, who are part of the interdisciplinary team that makes up hospital-based violence intervention. And what surfaced was this real need to get real about some of the disparities, even in the way we look at work itself, the value of work itself, and those who are kind of closest to the problem and therefore closest to the solution, their value is not distributed appropriately, right? It's not honored appropriately in terms of compensation and lots of other things. And so this is not unique to our field. This is something we see, it's replete everywhere. But I'm really curious how you might advise, right, those who are on the front line to kind of be disrupting systems that they're in currently to kind of put to the fore their value, and how you might advise those who are allies to frontline violence intervention workers. Any thoughts you have about the actual work of disrupting these systems that actually shape our relationships, even in our movement?
I think in terms of the question about sort of being allies, um, I think that it is important for people who are not on the front lines, of this struggle, to realize that the people who are there uh, need resources uh, and opportunities. That's what they need. They need resources, opportunities, political cover. They need support. They don't need saving. And I think when people understand it from that perspective, that the people on the front lines can lead, and we can support them, then they approach the people on the front line with a different set of questions. They approach the people on the front lines with, what can I do, and how can I do it? And I'm trying to speak as broadly as possible, because the needs, I think, on the front line, on different front lines, are different. But I also think that it's important for people to see those individuals who are on the front line, who are community health workers, who are creating safety, as people who are helping them too. And I mean, when we even look at the levels of violence in this country, and you compare it, to other countries, I mean, it's just astronomical. And when we look at the amount of resources that are being pummeled into people who have weapons to reduce this level of violence, and they're actually not doing it. I mean, the combined costs of American policing in this country is more than the combined cost of every single military on earth, with the exception of the US military and the Chinese military. That's the cost. Meanwhile, when you actually look at violence levels, the US is in the middle of the pack, right? But then when we actually look at the return on supporting these workers who are on the front line, there's a huge return, right? In terms of just providing them with the resources and the support and the encouragement, and the ability to I should add, the ability to take steps away from the trenches for self-care.
Yes.
I mean, when we sort of provide those folks with resources, I mean, it transforms communities. And so for me, it's just like, okay, what do y'all need? It's almost, to take it off this issue, that sister in the church who always cooks up a badass peach cobbler. It's like, okay, what do I need? You need some peaches? You need me to cut up the peaches? Right. What do you need? I know you got this.
Right.
That's all folks need.
Yeah. It seems so simple, right? To put forth, okay, we clearly see the value here. What do you need? And it's quite another thing to actually, I love that you said political cover, because sometimes it does take political, the needs, be they monetary compensation needs, or as you said, time away for self-care, but they're also protection from a system that may not understand or value the individual. And that, I think, is something where protection comes in, where there's a real fighting to reshape, renegotiate the terms upon which this work itself happens. And something that we work towards tirelessly here at the HAVI. And we've, worked to actually put within the taxonomy of healthcare workers, the violence prevention professional, to really name, no, this is a profession. This is something that should be reimbursable by insurance, like a nurse and a doctor, right? We want to really help shape institutions with our frontline workers in mind. But that's,
can I add one quick thing?
Please.
And why can't those frontline workers be paid at the level of a physician?
Yes. Yes.
I mean, what is the job of a physician? To save lives. What is the job of these frontline workers? To save lives.
I mean, we could end the conversation right there, right? I mean, that's so powerful. That is precisely what we really need to interrogate, right? That how do we value work, right? If we are valuing the lives of people and those who save lives highly, then our frontline violence intervention workers and the work they do, the risk they take, caring, not just at the bedside, right, but in community, and our street outreach friends, all of those who work on the front line, that work should be incredibly highly valued in society. So I so appreciate that you said that point.
And I'm mentioning that just because, you know, for instance, I flew this morning, and people who are members of the American military, were allowed to get on the flight first, and then the person, as they're walking by, says, "Thank you for your service." I mean, I'm sorry, like, why can't we have a community recognition and even perks like that, for these folks who are truly in, reducing levels of crime and providing safety, for us all in the trenches, in our backyards.
That's right. That's right. I'm actually getting quite emotional to hearing you say that, because it gives me chills to think we, and many of our teams, and there are over 100 cities represented in attendance at this virtual conference. And when we are in person, there's a day where we all wear, our t-shirts, right, that represent the cities we're in, the programs that we run. And it's powerful. You see just the uniform, right? What our workers, how they rep themselves. And I think that as we gain momentum and people understand, certainly we saw it during COVID, in the evenings, people would go out on their stoops and just applaud healthcare workers coming back from the trenches, right? This real honoring of work and the workforce, that there be a day where we can have that level of celebration and common understanding of the incredible work that frontline violence intervention workers do to keep us safe, in our communities. So I'm just really deeply moved by what you said, and again, in the conversations we've been having about this for quite some time. It's our job as allies to fight for this, and to fight boldly for this. And it actually leads to another question, which is, systems don't yield willingly and without a fight. And we have a term for kind of whistleblowers, right? People who, and whistleblower protections, right? For those who want to disrupt some systems. And we recognize that there's real risk in doing that. But disrupting racism also comes with tremendous risk, particularly at a systemic level. And so there's retaliation. People, can lose their jobs. I mean, there's a lot of risk there. I'm really curious what you say to those who are like, all right, well, I'm in this. I'm ready to fight. I'm ready to get out there and push. What do we do with that risk that comes along with this work?
I think we first have to just be clear and honest about where the risk sort of comes from. What are the forces that are allied, against us? I do think that there are some uh, people who work as police officers or who work as prosecutors who imagine that their job is to keep communities safe. But typically, these officers and prosecutors and judges are represented by uh, unions, by lobbies that recognize the critical importance of imagining that there's this relationship between uh, law and order policing and reductions of crime, or mass incarcerating and reductions in crime, and feel threatened by any sort of force, by any body of people that demonstrates that there's actually a better and more efficient, way to provide safety. So I just wanted to, and so, I think this specific community of workers has some of the most powerful and well-armed, not just in terms of, bodily arms, but political arms, than anyone else, in this country. And so that's why, if I'm coming across as just incredibly moved and appreciative and sort of in awe of the work that people do, that's one of the reasons, why, because I know that political forces are literally aligned, against, this work. But I think, to your question, I just think it's critically important for us to realize that there's really no other way. There is no other way than to reduce the violence, the structural violence, the interpersonal violence, but I also think it's important for us to know that there are other people on the front lines with us, and so it's not on our backs all the time.
Yeah.
And that when you're doing this incredibly hard work, you at the same time have to take incredibly well care of yourself. Like it even more so than the average people. To give the analogy of a person who is a professional athlete, versus a person who just, goes and, plays basketball every now and then. The person who is a professional athlete, because of what they're putting their body through, has to take care of their body in a way that the other person who's just, hooping with their friends on a whole nother level. And I just think I think too, if we were to understand our work in that type of way, what we put our body through, not just, certainly physically, but emotionally and intellectually, we have to be willing to ensure that we're recovering, that we're taking care of, ourselves, even more so than other people.
Yes. I'm taking that to heart personally, and I know many of us that are in this virtual audience are hearing that cry for self-care and community care as well. It's and that this allyship work is not it's not a solo sport, right? This is something where we've got to know and be connected, that it's really about mobilizing power on a number of fronts to resist and to transform systems. But there is only one way, and it is the anti-racist way, right? And any other kind of is being complicit. And so if this is our path, that this is the journey, then there are things we need to know to do on this journey. And I really and cleave to one another. So I really appreciate those points. I'm going to have one more question, and then I'm going to open things up for audience questions. And so my staff are beginning to populate this list for me. So, but I want to talk about research and researchers. We've had a few sessions at our conference really talking about ways of engaging community in research. But research is kind of situated within the academy. It has all sorts of requirements. Getting funding for research has its own politics. And so I'm really curious, what does it mean to be an anti-racist researcher? How does one do that, engaging in a number of institutions to actually produce research and to stay within the academy?
So I think that's the very question we're seeking to simulate an answer for at our new Center for Anti-Racist Research, at Boston University. And one of the ways we're seeking to do it specifically through our advocacy work is by providing sort of research support to grassroots sort of organizations that are on the front lines of different forms of struggle. So to give an example, if a local sort of violence prevention group suspects anecdotally that its efforts have been more effective in reducing violence than sort of broken policing efforts, but they haven't been able to necessarily show that empirically, for us to be able to connect them with a researcher or a team of researchers who can study that very issue and provide that research for that organization that can then utilize it, in its work. What happens thereby, the way we're trying to create it is such that, there are many different scholars of different areas of expertise.
Right.
And many of these scholars don't have connections to groups on the ground, or those groups on the ground don't trust those researchers, and to really serve as that sort of trusted connector, but then also to be able to figure out ways to raise or provide funding for that matter. So the researcher, is supported, in the work that she or he is doing, and then allowing that researcher, just as the community is going to use that research, in its activism, in its actual sort of violence prevention work, the researcher can then go and publish that research, which will then only ideally enhance the work, of that organization and bring light to it. And so we're trying to create that mechanism, particularly within our office, of advocacy. And to me, that's what simulates, an anti-racist researcher. You're not just engaged in research in which you're identifying, a problem of, of racism, but you're literally working in concert with community who is on the ground trying to address that problem, who knows that problem, the best, and who could utilize your support and some technical skills you may have to really bring that problem to light, and then also come up with evidence-based sort of solutions, to that issue.
It's incredibly powerful. And if there's information about ways that researchers in our connected can be connected to your center, or those in our network who may be looking for researchers, we'd love to share that information on. So thank you for sharing. It's very exciting. And again, it addresses some of these issues with trust and connection, collaboration. Very, very exciting. So I'm going to move now to some of our audience questions. This goes back. This is a question from Hannah DeMassa about the culture of hospitals and universities, and that in those cultures we see the value they place on higher education, but much of the expertise of our violence intervention work is really community work. It's lived experience. It's a depth that really isn't necessarily seen fully. How do you fix something like that, right? What would that take?
So I think it either has to we have to develop a changing consciousness of those hospital personnel, or force a change in sort of policy. And so, for certain types of work, or for certain types of collaborations, or for certain types of efforts, what is considered expertise has to be relevant, and has to be varied, and it has to be addressing the actual sort of issue. And unfortunately, you're absolutely correct. Like, somebody who goes off to higher education and gets a few degrees and quote studies violence in libraries by themselves, somehow better understanding about violence specifically in a particular community, than somebody who have faced that violence, who've witnessed that violence, who have literally clinically engaged in trying to understand that violence in real time. is to me the height of all follies. Now, I do think that lived experience isn't necessarily expertise about violence everywhere, but that experience can transform into expertise in that specific community. And that's really what people need. Like, we need experts about violence here, not like, over there, not nationally. We need expertise, in this community here. And then, but it's also helpful, when someone has an understanding of ways in which those specific issues have been addressed in other places. They have an understanding of different techniques. And so instead of just devaluing someone because they haven't gone to, get that degree, why can't we provide people with support, to get that learning as they're trying to address that issue?
That's right. That's right. And what I love about what you said is and it connects to what you said previously, is there is different kinds of knowledge, and it's really about how do you link and connect those different domains of learning, understanding, expertise, because it's going to take all of us. But really part of this is about how to value. And there are structures that, again, look at certain domains of expertise and certain credentials for that expertise and says, well, that's the most important. And it's up to all of us to really interrogate that and say, well, actually, in this context, it actually is lived experience that will help us understand violence here. So really, really appreciative of that. So I'm looking at a question from, looks like Lavelle Folks, about considering the aggression in both tone and in some cases physical action being shown around the country in regards to some recent projects like the 1619 Project, CRT, voting rights legislation. How should Black and Brown Americans combat these attacks? Because they are both new and old, right? The framing that's used to lift up these concerns harken back to history. So how do people of color combat these sorts of attacks?
I think we have to get to the essence of what the attack itself, and the essence of the attack itself is trying to shift what the problem is. And so what the 1619 Project, what CRT, what Black Lives Matter activists, what, anti-racist researchers and activists have basically argued is that the problem is structural racism. But what others have said, no, actually the problem isn't racism. The problem is the 1619 Project, CRT, Black Lives Matter, anti-racism. And the reason why they're the problem is because they are saying, X, Y, and Z, right? And so I just think that it's important for us to understand that and understand historically, that's what happened. Like, enslavers said abolitionists were the problem.
Right. Right.
Jim Crow segregationists criticized the, quote, outside agitators who coming into our community to mess up the harmonious relations of the races. And now it's, these teachers who are trying to teach about racism in a society of racial inequities are trying to indoctrinate, right, while those teachers apparently who are not teaching about racism in a society of racial inequities are educating. And they say the teachers who want to have a multi-racial offering of authors in a multiracial society are indoctrinating. Right. And the teachers who primarily want to offer white authors in a multiracial society are educating. Right. So that's what you're saying? No, actually, we know what real indoctrination is. And indoctrination is what is the norm, what was before, and what we're challenging.
Really, really powerful. I think that's all we have time for today. Dr. Kendi, this has been a remarkable conversation, really, really rich. Thank you so much for your time. Thank you for offering some wisdom. I'm ready to have some peach cobbler myself and after this discussion. So just want to invite our audience to join me in thanking Dr. Kendi, and we hope to see you sometime soon.
You're welcome, Fatimah. Thank you so much. And thank you everyone for your work.
Okay, thank you.